Okay, I have decided to do a video diary about my HAE type 3 attacks that I've been having for the past 6 weeks continually. I've been in the hospital at least 10 times in the past probably 3 weeks. It's been happening so often that I tend to be in the hospital day after day after day, going into the ER, needing treatment because my home health nurse has been told that if I have any swelling in my face or my neck, I have to go to the emergency room to have them administer the Kalbitor. So my face and neck have been swelling. I haven't been able to get control of my stomach yet. It still is very painful. I tend to live every day at a pain level that's on a scale of 1 to 10, it's a 6. And it's now gone up to an 8 or 9. And the last few times my stomach was so bad I needed 3 shots of Dilaudid. I don't know how many milligrams or whatever they were giving me, but I required 3, and 4 doses of Zofran. Had 3 at the hospital, and I have pills at home, so I took one. I think it was the 6th to the 7th of July, 2015, and it was later in the night. I felt nauseous. I decided I needed to at least eat something, so I had a Go-Gurt, and the second that the Go-Gurt was swallowed, I became extremely nauseous and needed to throw up. So, yeah. And I'm tired of all of this swelling. It's getting to the point where I don't know what I'm gonna do. I don't know how this is going to be fixed. My doctor tried Ruconest on me. It did not work at all. But the infusion of Berinert did work. However, when I was in the office at my physician's clinic, I needed the infusion of Berinert, and I was in so much pain that I ended up becoming lethargic, disoriented, not knowing where I was, and I couldn't open my eyes. I just kind of, closed them. I don't remember everything. I'm seeing a neurologist, so we'll see if it's neurological or if it was just random. So I'm scared. I don't look like me anymore. You can see that my cheeks are swollen and under here is swollen. I normally don't have this, but my neck has gotten better, although right here, that's my port site, and every time they have to access the port, my skin reacts horribly. I'm allergic to the Tegaderm, and I hadn't been before. I was allergic to some tapes, not paper tape. And because I've now had this so many times, my skin has decided to react. And yeah. Thankfully, I'm able to laugh at stupid things. Like, I just make jokes when I'm in the hospital to get the nurse to laugh, so that I laugh, so that I smile and feel a little bit better, to make whoever's with me laugh. I like to make people laugh, and I like to laugh. I like to be silly and goofy and funny, and thankfully I'm still where I'm able to do that, and it really does help how I feel and how I deal with everything. It makes my attitude better. It makes me go from why me to, okay, I have this disease, and rather than being upset that I have it, I can say I have it and I'm going to work with it, not against it. I'm going to stay happy and less stressed out and not freak out, not be scared because I have it. I've tried to watch funny shows. Just, I gotta keep my mood up. Yeah. This is really hard for me because I don't look like me anymore. I know I have very high cheekbones, but this is not normally swollen underneath the cheekbones. My lips are a little swollen. My nose is really swollen. And right here. But my neck is going down. You can still see the crease right there. That I have all the time, but it's not nearly as noticeable when I'm not swollen. I just, want to be able to swallow, because you get dry mouth and your tongue gets swollen, and and then you're nauseous, so you don't want to drink anything, you don't want to eat anything, and makes you really, really uncomfortable. And so I was diagnosed with a horrible yeast infection the day that I became really lethargic. They decided to catheterize me because I couldn't pee. So they catheterized me, and, well, first the nurse looked and she went, "Oh my gosh." I went, "What?" She was like, "You have a horrible yeast infection, like really, really bad." And she had to grab another nurse to help her because I was swollen, I was irritated, and I didn't feel anything because the other pain from my stomach, my head, my whole body now is so intense that I didn't notice that. And then this past week, when I went in to the University of Utah, I was transferred from Lakeview to the University of Utah Hospital to have an infusion of Berinert because they keep it in stock there. And I got the Berinert, and my swelling went down so I could give them a urine sample, and they checked it, and I had a UTI on top of everything. And so now I'm on antibiotics, which are going to cause another yeast infection, and they make me nauseous, and, I'm pretty sensitive to medications, especially the pain meds. They're horrible. The shots of Dilaudid, the first one, makes me just sweat and, feel sick, and they have to give me Zofran, and this last time it was horrible. I had to lean back a little, but I like the bed up high because I feel a little like I'm suffocating if I lay down all the way. So I was sitting up, and she gave me the dose of Zofran first, and I wish they would wait the 5 or 10 minutes that it takes to become effective for me and then give me the pain medication, because I react so strongly towards having it there. And the horrible thing is I feel like shit when they give me the Dilaudid, and you know, I have to lean back and just kind of be like, okay, let it take over. And then, you know, I feel like shit everywhere from the pain meds, and I can still feel the pain in my stomach, and it is horrible. So I let them give me more Dilaudid, and I just end up feeling sicker and sicker and sicker, because they're trying to dull the pain down to a level where I can, you know, feel everything else that's going on with my body. And I don't know how to do this. I don't know how I'm going to make it through this. This is the first time in 4 years since I've been diagnosed where it's affecting me mentally so horribly that, you know, I have said, why me? And I never get that bad. I never get to why me. Because everybody has their trials and their cross to bear, so to speak. And this is one of mine. And I need to find a way to get through it without being negative about it. You know, yes, in a few years I'll have to get a new port. And the years go by so much faster than I wanted it to. 5 to 10 years is how long they last. I've had mine for 2 years now, so I have 3 more years, which is not really comforting, and I know it's going to be 5 years because of how often it has to be accessed. At least 2 times a week. If I have to go in the hospital and they can't get a vein, they use my port. And unfortunately, because of the swelling everywhere, it is super hard for them to get a vein that will work. And I have scar tissue on all of my good veins from having the infusions peripherally. Yeah, I think that's what it is. Intravenously. There's just so much scar tissue in all my veins. The veins on my hands, the veins on my wrist, the veins in my elbow, the veins on my arm. All of them have a lot of scar tissue. And so they can't really access a vein easily because the vein clamps down as the swelling goes on, and then you end up with them having to access your port, and it's really dangerous in the ER to have them access the port because you're sitting on a bed where someone else sat who could have had MRSA or anything, and that is so scary to me that I am sitting on a bed in a hospital and they have to access my port, which goes straight to my heart, and possibly has horrible infections on it. It's the most dangerous place to have it accessed. It's in an ER. I ended up with a little bit of a cold. Not the last time, but the time before. Afterwards. So I caught something, and thankfully they have antibiotic discs at the hospital that they put directly on the port to help it not move from your port to your body, and then for it to not move any farther than it needs to, but it doesn't kill viruses. So I had a cold for a couple of days, and my eyes were really gross, and my nose was gross, and then it went away, and I'm really glad. I've gotten really sick before from having the port in, having the port accessed and catching other people's germs. You know, they scrub you and scrub you and scrub you, and then they access it, and unfortunately, you can't get rid of everything that could possibly be there. And I don't look like me. I keep looking at me and I see the redness from the irritation of my lips being swollen. My face is swollen. My eyelids are swollen. What else? Cheeks, neck, right here. That is not sexy at all. Right here. See it? Right there. That's swelling. Wow, I look so ugly. And I don't have any makeup on, as you can see. I really want to be feeling better and be able to do my hair, which is a mess right now. And do my makeup, do my nails, get things done, brush my freaking teeth. You know, it's like I have no energy anymore from all of the treatment, so, you know, I don't put makeup on, I don't do my hair, and I haven't done my nails, and I'm frustrated because that's part of me. I haven't even been able to go on my birthday pedicure, which I wanted so bad, and I desperately need. It's very gross, so I need to go and get it at some point. But lately, I've needed to keep calm, so I've been trying to be careful and staying in my room, staying away from anything that will stress me out. I'm scared, and I'm praying that my doctor can get the correct amount that I need of Berinert so that I can have it on hand at home and we can infuse it at home, which will be great. In a few days I see a pain management doctor for the first time at a clinic. It seems to be, from what I've seen, they accept insurance, which means they're pretty good, they're decent. You know, I didn't want one where they're like, come in with $100 and we'll give you some pills. Like, I didn't want that. I wanted a doctor who really believes in patient safety with these meds. I don't want to be prescribed something crazy that I've never heard of, and I take it and I end up, you know, even if I take it correctly, that I end up dead. Because that's what Josh did, my older brother. He took his medication as prescribed, but the doctor had made an error in writing it. He wrote it for too much, and he died in 3 days, and he had taken it as prescribed. And in 3 days, and he was just dead. So I have a huge fear, you know, because Josh was on pain management for years, and it's scary, very scary. I know I need it now, you know. I end up shaking from the pain. My whole body just, like, shakes and shakes and shakes and shakes, and I can't stop it. And, I hate to say this, but I have cried this last week about not wanting to go to the ER. I just didn't want to treat it, but I knew I had to. I have to keep going, I have to keep trying, but I was so tempted to, while I was having the face and neck swelling, this last time I was tempted to just lay down in my bed and go to sleep and let it kill me. And I can't believe that crossed my mind. You know, you feel like you're so insignificant because you're sick. You know, I'm on permanent disability, and I feel like I'm just stealing people's money so that I can survive, even though I know I qualify. Sorry. And yet all I want to do is be able to work. I would love to have a job. I would love to get to see people, talk to people, stand on my feet for 8 hours. That would be awesome if I could do that. And I can't. I can't even sit in a chair for that long without pain coming on and swelling. I don't know what's going on with my body. It is... I don't know what it's doing, but it's swelling all the time. And this weekend, Jeff and my dad went to the cabin, our family's cabin, and they've been the ones who have taken me and sat with me in the ER this past 6 weeks. You know, it's been hell. I'm just sick and tired of doctors and nurses and needles and the itching after I have Dilaudid and the itching on my arms from the shots and the welts that they cause, and I'm just ready to be where my attacks aren't coming on so much. You know, I constantly want to eventually have a child, and the way I'm swelling, something isn't working right. And I know that I would have to have my progesterone taken away and my IUD taken up to have a child eventually. My fear is so huge that it's never going to happen for me. I'm never going to be a mom like that. I don't want to adopt. I don't want a surrogate. I don't want those things. I simply want to be a mom. And I don't want it right now. My plan was to get married at 30 and have a child at 35. Wanted to be married 5 years before I did that, and I don't know. I'm 28 now, and I'm craving a child really badly. I'm genuinely happy for other people when they get pregnant and they have their beautiful babies. And, you know, people think I'm not happy for them. And I am. And I don't want people to feel like they can't tell me they're pregnant. Because I'm the kind of person who thinks babies are miracles. And there's always room for a baby. And it's always a good time to have a baby. Even if it is from something horrible, rape, that is still your child in there. You know, the baby could come from a horrible situation. You know, the mom could be whatever, but I believe that babies are just amazing gifts, and we really have to be grateful for them. And I hate that because of my disease, I have to be on progesterone and I have to have an IUD right now. I just want to not have either of those, and be able to use barrier methods until I want a baby. Because your body has to get back where it's going through cycles of ovulation and whatnot. But that's a scary thought for me, is the estrogen. What is it going to do to me? And I know I'm rambling, but it's nice to be able to say something, even if it's to a camera and there's no one on the other end. It makes this real and permanent. And hopefully everything will go well. But if it doesn't, I hope to be able to do these video diaries, and if something happens to me, my family can have these and know what I'm thinking and feeling, and I just love them and appreciate them so much for everything they've done. You know, I can't ask for a better dad, a better brother, a better mom. My doctors are amazing. My nurses, you bond with them. And I'm so grateful for them and for the services they provide to me, and the caring and the love they show. I don't think they know how important they are to me, how much they affect me in my life. Seeing them change people's lives and they don't even know they're doing it. You know, going in to get my infusions these past few years with my port, twice a week. They allowed me to be healthy and not have swells so much, and they changed my life. I was able to exercise and walk really far and jog and play, and they provided so much relief from pain and my ability to breathe. I hope they know how important they are and how important their job is, and that they changed my life. Dr. Jones changed my life. He gave me my life back. He's been so caring, so kind. And, he tries to make sure that I'm safe, that I'm okay, and I hope they know they changed my life. They gave me my life back. They made it better. And if I keep not responding to treatment and I'm not able to live, they gave me 4 amazing years. After 3 years of looking for what was wrong with me, I got 4 good years. Really good years. part of my family now. Yeah. You know, they're not just people who just do their job and pretend like it's not important. They understand the importance and they care. And I don't understand it all the way, except that I'm very caring and very giving. But when I see someone else being that way to me after years of people, doctors telling me I was crazy, nurses acting like I just wanted pills, and finally, I walked into LDS hospital, and my heart was going so fast. My blood pressure was extremely high. My oxygen was barely above 90, and it would drop below 90. And the nurse came in and said, I'm going to get an IV started. And I said, no, I don't want any meds. And she said, what? I said, I don't want meds. I need to speak with the doctor. And that was the first time that a doctor came in and was like, oh my goodness, she's not after meds. Something's really wrong. And I remember her having me open my mouth and her touching below my tongue and under my, right here, under my jawbone, where there's a double chin now. And she just kind of touched it. And that was the first time that I was told what I have is angioedema. It was a great day. That was a great day for me. I was so swollen and I felt so crappy. And, me and my mom still had to go to the grocery store afterwards. And, I remember her saying angioedema. And I looked it up, and I saw that I could be allergic to my medications. So, slowly, one by one, I eliminated all of them. None of them were causing this. And so, I also saw that it could be hereditary angioedema. And, I was absolutely astounded when I read the articles about it. It was me to a T. It was everything I had experienced. And the hard part was finding a doctor. I went to an allergist who did an allergy test. Everything was negative. So I said, can I come back in? And basically, I made an appointment and I was going to go back in because allergists are the physicians that deal with this. And he personally called me on the phone and said, you don't have any allergies. I'm canceling your appointment. Don't come in. And I was devastated. I knew there was something wrong. And so I needed to find a doctor, and I called my insurance, and the girl on the other side of the phone, as I described what was happening, she knew what kind of a doctor I needed, and she found Dr. Jones, and I was his second patient with this. He now has about 10 patients with this, and I was the second one that had it. And I remember his face when I came in, and I brought my stack of photos of what had happened and what had been happening. And he just like stared at, he was like shocked, because only a week before he'd had his first patient come in, and she had the exact same symptoms as I did, and he had just come from a conference about HAE, and that was amazing to me, to find a doctor who understands exactly what I have. He knows the signs, the symptoms, he knows how to treat it, and he is the best physician for this in probably the country. Or at least, Idaho, Wyoming, Colorado, Arizona, and Nevada. I know those are states where I don't know which ones, but I know they're surrounding states, and that he has people who come to him from all over the country for this, and that's nuts. He's even had a patient from Australia, which is crazy. And he's just an amazing doctor. He treats food allergies, and he's amazing at it. He can get someone who's allergic to peanuts where they're able to be around them again. And he's one of the few doctors in this country that knows how to treat it properly, and can and does. And he treats HAE, and he treats another really weird disease that he's done some research on. And I always say, what's next, Dr. Jones? You're taking over the world, right? You're gonna go in and just like take it over. He reminds me of Pinky and the Brain, but he's both. There used to be 2 doctors in his practice, so one was Pinky and one was the Brain, and now he has PAs, and I love my PA, Jennifer. She is so sweet and so amazing, and so I don't know, I think all of the PAs together and Dr. Jones, they're all together Pinky and the Brain, because they treat so many things, and they specialize in them, and they're amazing at them, and they're caring about all of them, and that's just awesome. I'm amazed at all of the wonderful things that my physician does and that he's able to do. He's passionate about what he's doing. This isn't his, he doesn't hate his job like most people. I'm sure he's frustrated a lot. I'm sure he's tired a lot. I'm sure he's worn out a lot. But he's not like other doctors. He's passionate about what he does. And it shows in how he cares and how he treats people. And I wish that more people knew about him and would come to him. I got a couple of my family members to finally go in, and he's treating them for allergies, and they're doing really great. And you really couldn't ask for someone better to take care of you. He's always an advocate for me, always. When my insurance won't let me have something, he will call and talk to them. He was willing to take a meeting with the person. He even took off work to go and see one of the people at the insurance, and he got there and he got a phone call saying that his meeting was canceled, and they never rescheduled it. The insurance was really scared that, I had an advocate, and it's a really well-respected physician. If they're that afraid of him, maybe they should realize that that fear is because they know they're doing something wrong by denying someone who will die without treatment because they're the most expensive drugs in the world. And let's see, how many are there? There's Firazyr, Kalbitor, Cinryze, Berinert, and now there is Ruconest. So there's 5 drugs, and they are the 5 most expensive medications in the world. And, I could be a millionaire, and my money would be gone with this treatment so fast. Each treatment, each medication costs thousands of dollars. I'm talking tens of thousands of dollars. And it's pretty crazy because I have all of my medications, all of my treatment for Cinryze in the fridge at home. And we get a month's worth at a time, and then we have 2 doses of Kalbitor on hand, and then I get 3 Firazyrs a month, and to have all of that in the house is crazy. I live in a mobile home that I think is probably worth 30 grand. Well, that's like the Firazyr they ship me once a month. That is what those cost. And, you kind of like sit there and you're like, whoa, this is a whole nice house right here. I just, I wish the insurance would just give me money for a month. And me swell and swell and swell. But we have the money. That would be awesome, but it's not going to happen. I'm just grateful that this insurance has been amazing. They constantly allow me to have 2 Kalbitors on hand at all times. That's how it goes. And they have been so great, making sure that I always am not denied any of my meds. They've been amazing, just at approving everything, not making me and my physician jump through hoops like my last insurance did. They have been great. I'm so glad I switched to a different company. I'm now with Regents Blue Cross Blue Shield of Utah. Before, I was on SelectMed. I had SelectMed Plus, and I visited the ER twice in 1 year, and the second time I went, I got a call from my insurance, pissed off that I'd gone to the emergency room. They said, you can't go again. We aren't going to pay for it. And I went, I have met everything. The deductible, the out of pocket. I'm sorry that my meds cost so much, but I can't administer this medication unless I have an RN. And I don't have a home health nurse. And the attacks are horrible. And the only way to get it treated is either at my physician's office or the ER. So I get them at the physician's office as often as I can, but at times I can't. So I have to go to the emergency room. And the person on the phone was just so rude. I started recording the calls. I talked with the pharmacist about it, and she was horrible. And she said things that were just so mean and so tactless, so callous. Like I wasn't a person because I was sick. So I am so glad that I have this new insurance and that they understand a little bit better what I have, and they don't deny me medications or treatment. They understand I have to have meds and I need my treatment. And I'm glad that I switched, and I'm really glad that that they haven't been really harsh about anything. They've been great. They've helped me a lot, even though I keep swelling. You know, it's something I can't control. I try to keep my stress down, my anxiety, everything. I try to keep it all down. And sometimes they still swell, and right now has been a horrible time. And most of the swells, I don't know why they happened. I wasn't ovulating, I wasn't on my period, wasn't stressed, I wasn't worried, I wasn't anxious. And they just kept happening. I hope that this last time was enough. That maybe we got on top of this time. I feel like we have. I'm not in as much pain. And my face is so much less swollen. I have cheekbones again, but I'm still a little swollen. But it's nothing bad. You know, my fingers look like sausages. Can't fit my ring on them. They're pretty swollen right now. This is swollen hand for me. I usually have really thin-ish fingers. My ring finger is 6.5, and I can't fit my ring on this. This is like an 8 right now. So, yeah. Oh, and I love rings. I love them. So, I guess I just kind of have to go without jewelry, but I love wearing jewelry.